So I want to talk today about the intermittent fasting concept, which is a fabulous concept, has been seen in science for a long time to show that calorie restriction can increase longevity. So they have been showing this in yeast and in bacteria, and now it's been shown in longevity diets with humans that the concept of intermittent fasting can be employed in many different ways. It's a big umbrella term that incorporates not just feeding windows, which is what people think about. I eat for 8 hours a day, or I eat for 10 hours a day, or 14 hours a day. Those are called time-restricted feeding. But it also incorporates periods of the week, 2 days a week, 3 days a week, where you're actually not eating more than 500 calories. And there's many different options for people to intermittently fast. The best way, I think, to start the concept of intermittent fasting is to try a 12-hour fasting with a feeding window of 12 hours, which means your last meal's at 7 o'clock and your first meal's at 7 a.m., so that you're going 12 hours to rest the liver. This concept of rest helps regenerate good bacteria in the gut, it helps rest the liver, it lowers inflammatory markers, it helps almost every organ in our body when we decrease our feeding window. So that is a very simple way to start. Other people can use a 2-day fast or 3-day fast, consecutive 3 days, or picking 2 days a week where you're fasting. That tends to be a little more difficult, and what you do, you want to monitor sometimes your sugar levels, your insulin levels, and your markers of inflammations, because that concept for some people is very stressful and actually increases the stress markers in their body. So when you're doing intermittent fasting, the safest way to do it would be to do a time-restricted feed. But be very careful if you have diabetes or you're on drugs like metformin, because you want to talk to your physicians about the concept of intermittent fasting, because metformin doesn't allow you to break down your glycogen stores sometimes in order to create the sugar you need when you're going for long periods of fast. So, and other people who are diabetic or have sugar issues, they need to be very mindful that they sometimes need to eat more regularly in order to balance their blood sugar. So you need to work with someone, either a dietitian, nutritionist, or a physician, to see if this kind of feeding plan might work for you if you have these other medical problems and are on certain medications. Walter Longo has brought this concept back through his Prolon concept. Prolon is a fasting mimicking diet that's patented, that's sold by the company called L Nutra, which incorporates a 5-day fast which has preset food, which is gluten-free and dairy-free, completely plant-based, with soups, bars, nut bars, as well as teas. But it uses the concept of mimicking a water fast. So markers that have been looked at, if you fasted with the water fast for 5 days, it has been shown to lower your markers of inflammation, your sugar levels, your lipid levels, some IGF-1, which is a marker for diabetes, as well as some cancer growths. All of these markers have been shown to decrease if you did a water fast for 5 days. But as we know, a water fast for 5 days is very difficult. So Prolon, even though you're eating, it tricks your body to think you're on a water fast. So the first day you do an 1100 calorie diet, and the second through the 4th, 5th days, you're doing a 750 to 800 calorie diet. So you're eating, but your body thinks you're fasting. And so you get the benefit of stem cell regeneration, which is new cells are being generated in your body, and the bad cells, the inefficient cells, the autoimmune cells, the precancerous cells can be destroyed because they're kind of starved. There's a concept of regenerating your stem cells, which then makes you kind of in a healthier state with a new immune system after you've done the Prolon consecutively for 3 consecutive months. So it's 5 days on, 3 weeks off, 5 days on, 3 weeks off, 5 days on, 3 weeks off. You do that for 3 consecutive months, and he's been shown to lower those inflammatory markers like C-reactive protein, insulin, lipids, and sugar levels. It's a fabulous program. It's got a lot of science behind it, and it's one of the things that I feel has changed medicine, and it is going to be a great asset for most people. Just ask your doctors and make sure you're working with someone, because there are some few contraindications of taking it, so you want to make sure that it's a right fit for you. Thank you for watching, and please give me some feedback on what you think of the topic as well as the content. And if you have any questions, please feel free to ask, and we will try to generate more videos to answer common questions.